Cat vaccines, like dog vaccines, protect against the most threatening infectious diseases to the cat population. We'll begin by addressing each individual disease that we are trying to prevent. Just as with the dog vaccines, we often use letter abbreviations to simplify record keeping. Again, each letter represents the first letter of the disease we are protecting against. The FVRCP, also known as the cat distemper vaccine, is actually 3 vaccines in one. The FVR stands for feline viral rhinotracheitis. This viral infection creates sneezing and a discharge from the eyes and nose several days after exposure. It can cause permanent damage to the nasal passages, producing a lifelong sneezing problem. Cats often continue to spread the disease in this condition. In summary, a very difficult respiratory infection to treat with often lifelong symptoms. The key? Prevention with vaccinations as a kitten and then annually after that. The C represents calicivirus. This virus is most noted for the oral ulcers it creates. It too has cold-like symptoms, but not as profuse as observed with the rhinotracheitis virus. It can go on to cause pneumonia in some cats. It too can linger, producing a cat that continually sheds the virus, infecting other cats. The P represents panleukopenia, a viral disease often called feline distemper, but not related to the canine distemper disease. An extremely serious disease, often having a deadly effect in young kittens. Symptoms include loss of appetite, lethargy, vomiting and diarrhea, with the diarrhea sometimes having blood in it. This viral infection is probably most similar to the parvovirus in the dog. Like the parvovirus, it attacks rapidly dividing cells like the intestinal lining. This is what causes the bloody diarrhea. Other important considerations occur with the pregnant queen. Because fetuses possess rapidly dividing cells, they are in danger of panleukopenia infections, resulting in abortions or birth defects. The virus can be spread through the urine, feces, saliva, or even via fleas. An optional additive to the feline distemper vaccine is chlamydia. Chlamydia presents as a severe eye infection in one or both eyes. The eye often appears puffy with large amounts of discharge. In addition, the cat may present sneezing. This bacteria is spread by directly passing infectious secretions to another cat. This disease seldom causes death, but complete recovery from this infection may not always occur, even with treatment. All combined into the same injection, we call it the feline distemper shot, or FVR-CCP. The next vaccine is the rabies vaccine. Basically, it's the same product and same disease as with the dog. Cats usually receive an initial rabies vaccination between 12 to 16 weeks of age, and every 1 to 3 years thereafter, as dictated by the state in which the cat resides. Though the feline distemper and rabies are the primary vaccines given to cats, the feline leukemia vaccine is often included in the feline vaccination program. Feline leukemia is a deadly disease caused by a virus that inhibits the immune system, creating the possibility of a number of secondary diseases and infections. It can also lead to various types of cancer. Either directly or indirectly, most cats that are infected with the feline leukemia virus will die from it. It is spread from one cat to the next by close facial contact, grooming each other, shared food bowls, and possibly fighting. It has been demonstrated that 1 ml of saliva contains in excess of 1 million viral particles. That gives you an idea of how small viruses are, as well as how contaminated the saliva of an infected cat is. Another way a cat can become infected is while it is still in the womb. The fetus can become infected by a queen that is shown to have the virus. There is also a segment of the cat population that are infected carriers but don't exhibit outward symptoms. This makes it very important to get every cat that has exposure to free-roaming cats vaccinated prior to contact. Prior to a cat receiving its initial leukemia vaccine, it is important to have a feline leukemia test done to determine if the cat or kitten might already have been infected. Remember that a vaccine is only effective if the cat hasn't been infected yet. There is no evidence that the vaccine does any good at all if the cat or kitten already has the virus. There are several blood tests available that can accurately screen those cats already infected. These tests can be run in 5 to 10 minutes, or a blood sample can be sent out to a lab for analysis. The last vaccine we'll discuss is feline infectious peritonitis, or FIP. Though not as common as feline leukemia, it is just as deadly. FIP spreads primarily through fecal transmission or the fetus is infected while still in the womb. Most cats that contract FIP are between 6 to 12 months of age, so FIP is primarily a young cat disease. The symptoms of the disease can vary a great deal, making it fairly difficult to diagnose. Cats may form fluid in their belly called ascites, giving them a bloated appearance. This, along with a fever and weight loss, tend to be the most obvious external signs. There are blood tests, but at this time they have limited accuracy in confirming a diagnosis. The vaccine is given intranasally. 2 boosters are given 2 to 4 weeks apart initially, and annually after that. The effectiveness of this vaccine is relatively uncertain. It is recommended that pet owners and animal care professionals concentrate on maintaining a hygienic environment, thus limiting a cat's exposure to the virus. This disease is more common in areas where numerous cats are present. So a cat may receive the feline distemper, rabies, feline leukemia, and the feline infectious peritonitis vaccines. All or a select group of these may be needed. Your veterinarian can design a custom program to protect the cats in your area.